Hello, I'm Charlie Craddock from the bone marrow transplant program in Birmingham, UK, and it's a privilege to be able to discuss data that we presented at the Tandem meeting in the US this weekend. FIGARO was a randomized trial aimed at examining whether there was benefit of utilizing the FLAMSA-Bu conditioning regimen in older allomandatory adults with acute myeloid leukemia. The control arm was a standard RIC regimen, either FB2 or Flumelcampath. The results of the trial were that there was no improvement in survival or reduction in relapse associated with using a FLAMSA-Bu regimen, and that's impacted clinical practice, I think, substantially. And the search is still on to find the optimal conditioning regimen in older adults with AML. What we were able to do in FIGARO as well, and this is work that was primarily led by Sylvie Freeman, was to sequentially study in a prospective manner the impact of pre and post-transplant MRD as determined by flow immunophenotyping on transplant outcome. And we also had the ability to see whether the acquisition of full donor T-cell chimerism at day 100 impacted on outcome. So the results of this analysis, which was performed on all patients who went into the FIGARO study, was firstly, as previously reported, was indeed the presence of flow-determined pre-transplant MRD is associated with a higher cumulative incidence of relapse. It goes up from about 20% in the negative population to 40% in the patients who were MRD positive pre-transplant. And in this extension of that analysis, Sylvie was able to study whether patients had evidence of MRD post-transplant and what the implications were on outcome. And she found that in about 15% of patients, there was detectable evidence of MRD. And she was able to demonstrate that those patients had, perhaps predictably, a poor outcome, with an overall survival coming down to about 30%. And furthermore, Sylvie was able to demonstrate that actually in multivariate analysis, the presence of flow demonstrated MRD positivity post-transplant was the most important predictor of outcome. And then finally, she studied the interaction between acquisition of full donor T-cell chimerism at day 100 and MRD positivity post-transplant. And of great interest, given the interaction between pre-transplant MRD chimerism and outcome, Sylvie was able to show that there was a very high risk of relapse, about 70%, in patients who were flow MRD positive post-transplant who didn't switch to full donor T-cell chimerism. But interestingly, in the patients who did switch to full donor T-cell chimerism, first of all, there was a very low rate of post-transplant flow MRD positivity. And secondly, it didn't seem to impact nearly so much on outcome. So I think taken together, these data add to a growing body of literature that measuring pre and post transplant flow MRD, we're going to become much better at prognostication of outcome in patients who've had a RIC allograft. This is important because we'll be able to identify high-risk patients who may benefit from potential interventions such as rapid tapering of immunosuppression, prophylactic DLI, or maintenance therapy, and also a population of patients who actually will have a very good predicted outcome without any further intervention. And then finally, I think this ability to study prospectively the interaction between full donor T cell chimerism and MRD is really intriguing, and it underlines, I guess, what many of us think, which is that the main mechanism by which reduced intensity transplants eradicates AML and delivers long-term survival is through the graft versus leukemia effect. We know it's a potent effect even after RIC allografts, and that makes one believe that future strategies to improve outcome in patients having a RIC allograft should perhaps less focus on optimizing the conditioning regimen and rather thinking about strategies that switch patients as quickly as possible to full donor T cell chimerism. And then finally, I think these data just underline the value of prospective randomized studies in transplant, in AML. Although the primary question of the FIGARO trial was negative, I mean, there was no benefit from the FLAMSA regimen, that still had a significant impact on transplant practice. It actually saved the NHS a lot of money by shortening hospital stay. But just as importantly, I think what is clear is that by prospective evaluation of key translational studies such as MRD and T cell chimerism, one can really get a much more profound insight into mechanisms of cure post-transplant and also guidance for design of future trials. So thanks for your attention, and we hope be reporting on the results of a relevant study, Amadeus, which is looking at the benefit of post-transplant CC486 oral azacitidine maintenance in the coming months. The study, we hope, will be closing by the end of this year. So that will be testing one of the plausible strategies by which one could improve outcome by post-transplant intervention.